question.
Okay.
Hello, and thank you very much for coming. Okay, wow. It's a lot of people, huh? Okay.
Hello. I'm not used to this many cameras here, so it must be the people around me that are attractive. Mr. Commissioner, Dr. Kovachev, MEPs, friends, I'm Anders Olausson, and I'm the President of European Patient Forum, and I'm extremely happy to welcome you all to this day, to this inauguration, or to give birth to the interest group of patient access and health care. And we're going to hear, everyone has got a program, I hope, so you can follow this. I'm also a little sorry for we are a little late, so we're going to push for it and leave the floor and the time to the people that are most interested to listen to, and that is not me. I just would like to say that access is really the core front and the fundamental for patients and for European Patient Forum. Access to health care, access to drugs, to treatment, and to knowledge and to information is a cornerstone. Without that, we don't have a Europe that is worth with a healthy Europe. So this is why we are so extremely happy for today, that having this meeting today, and also having all of you here. I'm also very happy that we have working on the Vilnius. This is some kind of continuation of the Vilnius Declaration that we sought to unify the stakeholder and bring about the involved in the driving action on these issues. So I'm very happy for that. And of course, I am extremely happy for having the Commissioner here, but I will give you some nice word later. So let's first talk and listen to Dr. Kovachev, MEP, who is really our friend in this. Thank you.
Thank you very much, Anders, and welcome to everybody here. Commissioner, welcome, and thank you very much for following our invitation. Dear colleagues from different political groups, different countries who are supporting the platform, dear guests, I'm honored that I see this room which we reserved is small actually, and we have so many people interested to the topic, because indeed Europe, it's difficult to explain to European patients and citizens why European Union is taking more care maybe on agriculture and animal welfare, but not on human health. We talk about growth and jobs for European citizens. This is what we are doing here in this House for the last few years. But none of these goals can be achieved without the European citizens. On one hand, we say healthcare is a priority for Europe, but from the other side, the healthcare responsibility is fully in the hand of the member states. What we can achieve more as an added value of Europe to provide to the member states more tools and possibility for equal quality according to the 21st century health service to our citizens. Member states account for different models of healthcare management. Some national healthcare systems are underperforming in terms of public spending efficiency, but also in terms of quality and access to medical services. This is the case, for example, in my home country, Bulgaria. This is also cases in many of the old or the new member states. Inequality in healthcare services provoke migration of patients towards member states where medical treatment is better and easier to access, even in some cases life-saving. The same holds true for healthcare professionals, doctors and nurses who are looking for better conditions to have a better career development in member states with more competitive healthcare system. This makes the problem of access not only problem of the new member states, but for the all member states. This is a problem which we recognize here as a problem for all member states of the unequal access to quality healthcare. As a result, human health needs are not equally addressed across the European Union, with tangible consequences for the performance of the European workforce. Poor healthcare quality in one member state provoke burden for the budget and social security system of the rest of the European Union. The European Union growth and jobs objectives is undermined. Patients are paying the cost of non-Europe. This sentence we repeat many times on many occasions, not only in the health field, but in many fields, that the answer is more Europe. But now it's to us, to the stakeholders, to the patients, to the doctors, to the nurses, to the industry, to give the answer. What exactly is the answer in the healthcare field? I see the platform already as a fact existing, and the group in the European Parliament, and together with the Commission, as a good possibility to identify this priority, this added value of Europe in the healthcare area, which we can serve with which we can serve our European citizens, and European citizens, unfortunately, in the life of everybody, in some point of time, everybody is a patient as well. So to serve the European patients with adequate to the 21st century health quality service. I will stop here, and I'm very pleased to hear the debate also with my colleagues later on, but first of all from the Commission, how the Commission see this platform, and what we can do together, Parliament, the platform as a stakeholder organization, and the Commission to serve our European patients. Thank you very much.
Thank you, Dr. Kovacev. It's very nice to hear your words and also the statement and the analysis. Mr. Commissioner, since you made it difficult for yourself, because you have stated when you started as Commissioner that you're going to work hard for improving the healthcare of all EU citizens. So access is really a cornerstone in that. So please, we are looking forward to hearing you.
Of course. Honourable members, ladies and gentlemen, Mr. Chairman, yes, you are right. I fully agree with you that access is cornerstone. I'm very pleased to be here to join you for the inaugural meeting of this interest group on access to healthcare. I'm very happy about it. Personally speaking, I'm so happy today. Can you imagine? I fully support the European Parliament commitment to raise awareness on this issue. Thank you for giving me the opportunity to add my voice to this important initiative. As the EU Health Commissioner, I have an overview of the health performance of each and every EU member state. I know that problems of access are found everywhere in the EU, but their intensity varies within and across member states. In many countries, voters have already sent a clear message. It was not so, it was a few days ago. They would not put up with policies that not only neglect citizens' rights to access health care, but eventually pushes them below poverty line. Maybe I am wrong. Let me mention some numbers to illustrate disparities among European Union member states. Please, I would like to show you first slide. If you look at the slide portraying life expectancy in the EU, you will see social determinants in health. You see green color and yellow color, and you see two different pictures. And my job is to make European Union more greener. Can you imagine possibilities to make European Union more greener in my term of office, only 5 years? I have I have 4 years and 9 months, because I lost 3 months. No problem. Can you imagine make European Union more greener without you? No, it's impossible. Slide 1. On average across the European Union, health spending decreased by 0.6 between 2009 and 2012. In some countries, especially in those which suffered from economic crisis, it has fallen drastically. Slide second. Okay. Unmet needs for medical examination are reported by more than 12% of the population in the lowest performing EU member states. It's evidence. Slide 3, please. Life expectancy between EU member states has a gap of 12 years for men and 8 years for women in the highest and lowest performing countries. Next. Infant mortality rates, dramatically, yes, differ sixfold among European Union member states. My job is to investigate how we can close these gaps between member states. Barriers to access to health care can be multiplied, of course. Financial, administrative, geographical, legal, and cultural. Barriers may affect particular population group or simply result from an insufficient or inadequate distribution of resources in the system. For this reason, health policy is a broad responsibility. It is not just for health ministers or health specialists. It is for all parts of government and for all policymakers. Therefore, I stand for a health in all policies approach. And let me give an example. When access is limited for a particular population, for example, populations in rural areas that don't have access to adequate services, the solution might lie with other policies such as transport. We must raise questions about transport, how to deal with transport, to raise questions when we speak about accessibility. For this reason, I want to ensure that health is an integral part of all relevant policies, including environment, social, and economic affairs. You may know that my priorities are simple: prevention, promotion, protection. Thanks to my young followers on social media, I would also like to add an additional P: participation. Participation in the other 3 Ps. And this is an example about participation. We need to play our part to the full, be it in Brussels or in the European capitals. Therefore, I want to highlight the importance of partnerships with all the relevant stakeholders. They are essential to gain insights on the ground and help with identification of barriers. The initiative launched by the European Patient Forum is a good example of such mutual beneficial partnerships. My services have been involved in the discussions with members of European Parliament, professionals and patients' associations, industry representatives, and other stakeholders. Some members of European Parliament, such as our host, Mr. Kovachev, have been particularly active in those discussions. It goes without saying that I fully support the goals of this interest group. For this reason, I hope that my priorities will be able to benefit from the political support of this House and through this interest group in particular. There are a number of actions that could complement the goals of your interest group. Let me give you some examples. The communication on effective, accessible and resilient health systems, published in April 2014, which defines 3 pillars for a health system, and one of which is access. The implementation of the Directive on Patients' Rights in Cross-Border Healthcare, which will serve the increased transparency for patients on national health systems. The development of the European reference networks, which will be a priority in 2015. It's my job today in 2015. The expert group on health system performance assessments, which will help us to guide and support the enhancement of health systems to improve patients' outcomes. Of course, the European semester can increase the prominence of health and access to health care in the recommendations made to member states. My services DG Sante will coordinate closely to support and complement policies in the fields of social inclusion and social protection led by DG Employment through the open method of coordination. We are ready to do it. DG Sante will also continue the joint action on chronic diseases, helping to facilitate the exchange of good practices in tackling chronic diseases and promote healthy aging. My idea is to have all 28 countries, member states profile, speaking about chronic diseases, and see which instruments are more powerful in which countries, and to support those countries to act in proper way in seeing our map, to make our map more green. We have now started our third health program, 2014-2020, which is a key instrument for investing in health and promoting growth in Europe. Plus, we are supporting member states in their commitment to address inequalities in access. We can work together on innovations that benefits patients and in driving solutions to patient safety, including the prevention and control of health care associated infections. Finally, the Commission is supporting action on patient empowerment, a fundamental tool to improve efficiency of health systems, reinforcing healthcare quality and improving patients' outcomes. The Empowering Patients in the Management of Chronic Diseases is called NICE Empathy initiative, aims to deliver research to inform the development of EU policies in this area. Honorable members, ladies and gentlemen, but it's mostly friends or like-minded. I see people which are like-minded. More than ever, we must not forget that access to health care acts as an effective safeguard against poverty. My job is to identify key obstacles in access to health care for patients and facilitate dialogue between European and national health stakeholders to assess gaps in access to quality health care within EU member states, to address these gaps through collaboration, and to help in finding substantial solutions. Let me finish by thanking all the honorable members involved in the creation of this interest group. I look forward to our future fruitful cooperation. I am confident that our actions can and will make an important contribution towards improving access to health care across the European Union and changing European Union color. In 5 years, our obligations a little bit changed such color and more green color. Thanks a lot.
Thank you, Mr. Commissioner. Thank you. I like to be greener. I don't know what the environmental people think, but I think we will hijack that, make Europe greener. So I think that gives us a picture of what we wanted. This is, I'm really excited here. I'm really looking forward the next 4 years to where we're heading and where we're going.
In 9 months.
9 months.
9 months.
4 years.
Yeah. But we.
Okay. 4 years and 9
months. 4 years and 9 months. You open so many doors with what you're saying. So be ready. We are coming. All of us here, all the stakeholders in the room. Okay. Thank you. And now we're going to hear a virtual version of the Bulgarian Minister of Health, Mr. Moscow. Or do you say Moscow or Moscow? No, Moscow.
Moscow.
Moscow. You don't say Moscow, no. No, Moscow. Sorry for that. Who's going to be virtuale?
I have the honor, and I'm happy that we have at least from 28 now, 1 member state who already expressed the support to the partnership, and I'm sure that also the Minister of Health of many of the member states will follow the Bulgarian Health Minister, Mr. Petr Moskov. He sent us just this morning address supporting the initiative. He was so officially invited to be here, but unfortunately, due to his political work in Bulgaria, cannot be with us. And he expressed his support to the Access Partnership, will engage with stakeholders and involve them in the semester process, which is a very good, as the Commissioner also mentioned, instrument for identifying the gaps and recommend to the Member States the necessary reforms in the health system. Minister Moskov also is ready to call to other Member States to be on the same level and support the partnership in the Council, because without the Member States, as you can imagine, we cannot do it. We are here at the European level. We go for, some of us are more federalistic approach and would like to see Europe more united and more federal, but the reality is that we need, especially in such field like the healthcare, the member states. So I'm very happy that many colleagues, even if they cannot be today with us, express their support in the European Parliament for the platform and for the initiative, and I will call to them also to contact their ministers of health and governments, make them knowing about the platform and asking as well for their support. Thank you very much.
Thank you. Okay. We have a short intervention. Let's understand. Is that possible? It has taken 7 minutes. Yeah. He will listen to you.
Oh, okay.
I promise the Commissioner you will speak in 7 minutes, which is a challenge itself. This is all good initiative. I just want to say that. All good initiative always comes from the heart. And this initiative with the access wouldn't be able to be where we are today if it wasn't for Stan and his work with his colleagues in Bulgaria. Really from the heart. So please, Stan.
Thank you. Thank you, dear Mr. Commissioner, for staying for this speech. Dear Dr. Kovachev, honorable members of the Parliament, dear guests and friends here in this room, it's really honor for me to come to this stage after few years of efforts of bringing the different stakeholders in the same room and to be on the same track and talking about access, willing together to address the access issues. But let me remind you why we are all here at the end. As chairperson of National Patients Organization in my country, which represents more than 80 patient groups, every day I meet with patients coming from different disease areas. Patients who are fighters, patients who are really good fighters and doing really well, even sometimes they're in a very difficult situation. I also have the opportunity to work with our government on a daily basis, trying to reform the healthcare system in the best possible way for the patients. And I know how challenging it might be for the member states as well to address all the issues that they might have. As board member of the European Patients Forum, I have the opportunity to know that the access issues are not only a problem for my country. Actually, they're a problem for other member states as well. And within the member states, there are some challenges in every single disease area. And now, as Secretary General of the Patient Access Partnership, I know that challenges are also for healthcare professionals, also for those who take care for the patients, also for the European institutions, also for the industry. And I know that the only way that we address these issues is to work together. I will give you 2 very small examples. Right now, we all know the revolution with hepatitis. We have real medical revolution, something that's coming that could change the game, and many patients would benefit of that. This innovation was driven also by European researchers, by people who invested lots of time and knowledge to develop this innovation. But at the same time, I know that for some patients, the innovation is not going to be accessible in the near future. Maybe some of those people are not going to be alive at the time when we can assure access. Let me give you another example. There are areas and regions in Europe where patients simply don't have access to healthcare professionals, to services, to nurses. And they suffer from diseases that are otherwise preventable, treatable, if they have the proper services around. So this is actually the fundamental rationale for the Access Partnership. It's easier to ignore the situation, it's easier to continue the business as it is, but it's not acceptable in nowadays Europe. That's why we have to see access as a basic human right and a problem for the solidarity between member states. Let me remind you how we got here. Very briefly, everything started more than 2 years ago with a small conference in Sofia focusing on the new EU member states and health inequalities, widely politically supported by our politicians in the parliament and also the local politicians. Then the strong political support from the EU Parliament and the Vilnius Declaration coming to the point when we have the European Access Partnership established end of last year, which is aiming to force and to develop, to drive and propose to the European Commission and the Member States sustainable solutions, solutions that will help the Commission and the Member States to improve access. And now, at the end, where we want to go. We want access to be high in the political agenda of the European Union and the Member States, and also for all stakeholders. We want to use all possibilities and political instruments to engage and support Member States to address access challenges, such as the European semester, and we already have some very good examples of engaging with the Commission and the Bulgarian government on this process, and hopefully it will lead to good results. We want to analyze hurdles, to identify gaps and barriers, so we are able to influence and support the Member States. We want to develop, drive, and propose solutions that work for patients and for the stakeholders. I'm really happy to hear all words today. I'm really happy that we have this huge support, political support, from the members of the Parliament coming from different countries. And we are really grateful and hope that their work will help all of us to drive towards better health in Europe and to assure better access for the citizens. At the end, I will simply say the Access Partnership and the interest group here on access are in its infancy. They need to be cared and they need also to be supported. Trust and commitment of everybody in this room. Equitable access is everyone's business, and this means more than words. It means hard thinking and hard work. Thank you.
Thank you for that. Thank you very much. And while I say goodbye to Mr. Commissioner here, I would like to open the door for Christian Silvio Buschi. Sorry for that. I'm from Sweden. For the first Parliament speaker.
Yes. Can we go? The members come.
We should go upstairs.
Yeah. Yeah. Maybe all the MEPs who are going to speak can come up and sit here now.
The co-chairs of the group.
I stay.
You stay.
So I can be the voice in between. I must say that this is fantastic to hear all this. Don't you feel the same? Hello. It is. It's a great day and it's a great initiative. So we have 6 MEPs who's going to say why they support this, and I was asked to say that also, what are you going to do in supporting this? I thought that was a little close to a rule, but it's a strong thing. Anyhow, so let's begin.
Thank you so much. Thank you so much for inviting me, and I'd like to thank Mr. Kovachev very much for his invitation to be a part of this event and also to co-chair the interest group on patient access to healthcare. Unfortunately, I will not be able to stay the whole event because I have a special guest from Timișoara, my city, and at 1:30 the event will start there. But I insisted to be here because I really support this initiative, and I think it's an important initiative for the future of patients' access to health in European countries. Health inequalities usually result from the uneven distribution of social and environmental determinants, the different access to resources as education, employment, or health services, different levels of participation in society, and different levels of control over life. It is known, and we have to recognize this, that many countries in the European Union, such as Romania, my own country, Bulgaria, Greece, Portugal, Italy, continue to experience marked and deteriorating health inequalities, which disproportionately affect vulnerable and socially excluded groups. There is an evident difference between resource-limited member states, most of them from Central and East European, and the wealth ones, the old members of the European Union. Although wealth in Europe has increased in the last decade, its distribution has proven to become increasingly unequal. There is still a high number of people living in poverty, including one child out of 5 being born and growing up in economic and social deprivation. Still, these numbers are likely to be even higher when accounting for parts of the population not existing in any official records. For this reason, it is important to ensure that new treatments will reach patients equally in every corner of the European Union. This needs to take place continuously, predictably, and within respect to the EU legislation. There is also an increasing necessity for coordinating actions across various policy areas, as well as the involvement of other non-governmental and political stakeholders. Last but not least, European health systems must ensure to deliver high quality and safe health care and public health services accessible to all, including equal access within and between member states to modern and cost-effective treatments. Thank you very much, and once again, many thanks and many congratulations for the initiative of Mr. Kovachev.
Dear guests and colleagues, I need to repair one mistake what I made at the beginning. I forgot to announce the co-chair of the interest group for access to healthcare, and I'm very honored that these colleagues accepted to be co-chair in this interest group. I think we have a lot to do in the next years to come, together with the partnership with all stakeholders, but now the name, Biljana Borzan from Croatia, Marian Harkin, I think she's not there today, but she accepted also the invitation, Cristian Bușoi from Romania, Karin Kadenbach from Austria, welcome, Katarina Konečina from the Czech Republic, and myself. So we are 6 co-chair of the interest group. And many other colleagues who accepted to support the interest group, like Charles Tannock from UK, Alois Peterle, he was at the beginning there from Slovenia, Madame Salden-Mose from Denmark, Teresa Komodini-Kachir from Malta, Karol Karski, he was, I think, there but just left, from the ECR from Poland, and my dear colleague Vladimir Uruchev from Bulgaria. Also many others. I'm sure in our work we will have the support of many other colleagues from different member states and political groups. Thank you very much for your attention.
Thank you. Thank you. Thank you very much. Can we follow? We take the number from the top. Biljana Borza. And I'm very sorry for the pronouncement of the name.
Very well.
Okay. Thank you.
Thank you. I would like to thank, first of all, Mr. Kovacev for organizing this, and thank you for inviting me, of course. Well, dear colleagues, all of us all agree that, unfortunately, health issues are not so high on the agenda of European Parliament because of the subsidiarity system. But I think that we also agree that this is a very important issue, and there are a lot of problems that we can work on together in order to have a well-organized health systems in all member states. If we look at the Treaty of the European Union, it says, and let me quote, "The Union is founded on the values of respect for human dignity, freedom, democracy, equality," and so on. If we look at the facts regarding healthcare, there are a lot of differences, and we cannot talk about real equality for all EU citizens. As Mr. Commissioner mentioned, the difference in life expectancy, for example, between Latvia and Spain is almost 10 years. Also, there are a lot of differences in incidence of cancer, infectious diseases, and so on. These and other important issues are in great part caused by the difference in access to healthcare between member states. I'm aware that those differences depend on GDP of member states and that healthcare budgets vary from state to state. We must take note that financial crisis had a different impact on healthcare systems of different member states. Good example of how EU can improve a common health problem and act together is a tobacco directive. We all expect that this directive will lead to decreased smoking, especially among young people, and consequently decreased incidence of lung cancer and other smoking-related diseases. I think that same or similar action should be undertaken on alcohol abuse, because we know that Europe is the hardest drinking region in the world. Abuse of alcohol is higher in rich countries, but negative consequences of alcohol abuse are felt more in poorer countries. One of the reasons for this is unequal access to quality healthcare. To conclude, I would like to recall something that Commissioner Andriukaitis said during his hearing. He outlined his vision for a health union. I have to admit that this health union is music to my ears. This corresponds very well with the principle of equality that is enshrined in the Treaty of the EU. And this is one of the reasons, I think, that why we are here today. Thank you.
Thank you. Thank you very much. And we're moving on to, then it's a challenge again to pronouncing Katerina Konechina. Close to right?
Yes.
Thank you.
Dear colleagues, dear guests, I'm glad that I can be present of this group. Health is a value itself and prerequisite for stability and economic growth. Investment in health and equal access to health services contributes to a healthy workforces and also to social cohesion and justice. I should be emphasized that the current policy of cuts and reduction leads to suppression of claims and patients' access to health service. I hope that with the help of this group we can stop this constantly deteriorating situation. Now I will be maybe more concrete and not so, and I hope that you will understand me why. I have been dealing with the issue of access to healthcare and the so-called patients' associations for a while now. However, I often encounter lack of knowledge and unprofessionalism within these organizations, which is a rather dismal from these very specialized associations aimed at protecting patients. Therefore, I have been supporting on a long-term basis a project called the Academy of Patient Associations that originated in my country, the Czech Republic, and whose aim is to cooperate with these associations to educate them so they can grow and improve their overall facilities and through this promote better and more effectively the rights and interests of patients and their families. The aims of this project, which is currently trying to implement beyond the area of Czech Republic, are to promote the independence of patients' associations and other organizations, to allow their long-term development, to teach them how to effectively raise funds from various domestic and European sources, and to improve their presentation and negotiation skills. For this purpose, the Academy hosts a number of tutorials and meetings every year, where they transfer their knowledge to the patient's representatives with the help of many experienced lecturers and experts of fundraising, project management, and strategic management or communications. Currently, we are trying to expand this project to other member states, and therefore I would be very pleased if this project and the overall issue of patients' associations, their activities, and their mutual cooperation could be one of the enterprises in this group's program. Ladies and gentlemen, thank you for your attention. I look forward to your cooperation, and I very thanks Mr. Kovachev that you give it so nice meeting today, and I hope that we will be continue with so nice meeting, and it will be maybe so not only about the world, but really about the work as a whole for people in the whole Europe. Thank you very much for your interest.
Thank you very much. I close to promise you that it's going to be work, much work on this. And then we're moving on to Austria, Karin Kadenbach, or Karin Kadenbach.
Whatever you like. Yes. Hello, my name is Karin Kadenbach. I'm a member of the European Parliament from Austria and a former state health minister from Lower Austria, the region around Vienna. It's my second term now that I'm in Parliament. And I'm also vice president of the Health Forum Gastein, an international platform where we meet annually to discuss with stakeholders everything about health, health security, health care, and so, yes, let me do a little bit promotion. You are invited to join us this October again. One of the main reasons why I'm very happy that this initiative now has its inauguration today, and that the room is so full of interested people and future partners, is that we have discovered that there is a big need for patient access to best medicine, to best pharmaceuticals, to best medical treatment. And I think what Commissioner Andriakis said before should come true. It's nice that I don't know if it's a coincidence, but on the invitation it's all dark green already, so I think that's quite one of the aims we have. Because it's nice to have words like health in all policies. It's nice to have a lot of big aims, but if we do have a public, and for me it's only the consumer, and it's not always the patient. I think the patient is the second part of it. First of all, you are a consumer in a health system, because I want to have a health system that also has health prevention so that you don't become a patient. But you have to have the access to all of this, and that needs to empower the people in Europe, to empower the patients to get this access, and that's why one of the most important things for me for this initiative is also to have and focus on health literacy. We do have studies in Europe that show that more than half of the Europeans have real problems and define the problems for themselves, so that they don't know where to get information from, that they do not know what a healthy diet for them looks like, they do not know what rights they have. And the same is not only true for the European patients, it's also very often true for all the stakeholders in the health system and in the healthcare system. And one more point is that we are always talking about innovation in the pharma industry, or that's at least one of the points we were talking last days here. And I think it's very important that we do have a lot of very innovative pharmaceuticals, but what we need is the access of the patients to all these medicines and to all these treatments, because, I mean, it's nice to have it, but if you can't get it when you need it, it's not much help to you. So that's one of the things I think the European Parliament and all our stakeholders should really work on, so that it's not a question of reimbursement systems in the different member states. That's not a question of the health care or health insurance system you're in, if you get best medical treatment, if you have the access to it. So these are just two of the points for the action I want to take in the next years. That's health literacy and access to best medicines and best medical treatment for all Europeans, independent where they come from, who they are, what language they speak. Thank you.
It sounds like we are getting a whole Europe soon when it comes to health as well. So the ambition is very clear, and we have heard great words and great commitment among MEPs and the Parliament and elsewhere. So I would like to open the floor, unless there is anyone who wants to say anything more.
A few words. And as you say, Anders, that we need to work, I was thinking on some concrete initiative what our interest group can do in the next months or weeks. For sure, what I mentioned already, contact with our national stakeholders and state authorities to advocate for the access partnership model to be implemented on also national level in the 28 member states. As you heard before, in Bulgaria we have already the commitment of the minister that he is ready to cooperate with us. European semester, what we can do is to influence the process, the amendments in our own initiative reports in spring and in autumn, but also even more important to push the national member states to implement these recommendations. Invite national policy makers. I can announce that already we have the commitment of Minister George Freeman from the Minister of Health of the United Kingdom that next time when he's in Brussels he's ready to meet our informal interest group maybe even in February. Advocate for a budget line, as the Commissioner mentioned about the identifying the gaps, a measurement tool where in the Member States what can be done. And for sure we can do something on information to our colleagues and to the Member States. Why not to publish a brochure to communicate to national stakeholders the opportunities to have funds under the either operational programs or Horizon 2020 or health program. All this communication, what many times it's complained, the European Union is too complicated, we don't understand where and what. When I visit hospitals in Bulgaria, this is the first thing what I say, hey, we don't know which program, horizontal or operational program we can apply, can you give us the advice? Why not also to be involved in this? But this is only few ideas, and I'm ready with my co-chairs, but also with everybody to discuss later what we can do, and following the process in the Parliament, in the ENVI committee, but also in other committees where the topic is coming to be active. Thank you very much from my side.
Thank you. Thank you. Okay, let's open the floor then to questions. Please say who you are and what you represent. Thank you.
Yes, thank you very much. I represent the Transatlantic Consumer Dialogue, which represents millions of consumers and also health activists in Europe and in the United States. We are very, very concerned that only a small minority of patients are getting access to the best treatment for a number of illnesses. Last week, we had many hepatitis C patients protesting outside the European Parliament. I come from Spain, that we have over 500,000 people affected, and only 5,000 people are getting the best treatment because the price is exorbitant. What I'm saying is, and this happens with many cancer drugs, most new cancer drugs that are coming out cost more than 10,000 euros per month for treatment. This is impossible for at least half of the European countries to treat most of their patients. Impossible. So we're not talking about necessarily always a win-win situation. We're talking about, on one side, we have some companies that are doing profiteering. On one side, massive, like for the hepatitis C pills, they're making over 1 billion euros a month just off this pill that is being sold for 80 euros in India, this 3-month treatment, and in most European countries between 25,000 and 55,000. The I&D cost, this is the mantra. We have no transparency about that. The industry itself admits that it spends less than 5% of its income on R&D, but we aren't choosing the failure. For no other industry in the world do the patients pay the failure. And also the public return has to be taken into account on public investment. We invest, the vast majority of the whole long pipeline of research is done with our money, taxpayers' money, and that's not reflected in the prices either. So what I'm saying is, it's a European issue. A few years ago and today, the European Parliament set price caps on roaming calls, calling between one country and the other. Nevertheless, it's taboo, absolutely taboo, to think about price caps on cancer drugs or hepatitis C drugs, of which tens of thousands of Europeans are dying every year, lack of the best treatment. So what we're talking about is an issue that could affect public research, EU competences, transparency. We don't have transparency yet on clinical trials, on prices, et cetera, et cetera. We're also talking about public return and public investment. We're talking about putting strings attached to EU funding. Why is it?
What you're saying is extremely important.
Yeah.
Please,
I will
do you have a question somewhere?
Yeah. My question is, how are we going to deal to make the prices radically lower? We're not talking about 20 or 30%, radically lower to the top innovative drugs, so the majority of patients in countries like mine, which is not the poorest country at all, but others like Romania, Bulgaria, can get access to the innovative cancer and hepatitis C drugs. Thank you.
Thank you very much. How can we make the prices of drugs lower? It's an easy question. Yeah?
Much lower.
Much lower. Then it makes it more complicated. Is there anyone here who wants, in the panel, who wants to say? Stan?
I think you're putting very good highlight in what I already said. We cannot simply invest in innovation and then nobody to be able, or only few people to be able to access the innovation. That's why I think the answer to your question is not easy, but this is the reason why we have the Access Partnership, bringing together the stakeholders, doctors, patients, politicians, also the industry, because I believe that no single stakeholder can find the solution of what you just mentioned, and this is only one dimension of the access issues we have. Think about the doctors, think about the pharmacists that are not there, it's everywhere, and all those issues need collaborative approach to be addressed. We cannot simply exclude the industry and say they are the bad guys. We cannot do that with the doctors and say they are the bad guys. We have to really find solutions that work for everyone, and I wouldn't agree with you that there aren't win-win solutions. I know there are win-win solutions, and we will find it, and hopefully we will do it within the concept of partnering between each other and to find the best possible thing for us and the patients, of course.
Thank you. Liana, short?
Yeah. Just short, one sentence. Maybe the one part of the solution is a transparency directive, which regarding the prices of medicines, but unfortunately it is stuck right now, and I hope that this situation will change soon.
Okay, next question we have Annette.
Well, thank you for this initiative. I'm Annette Dumas from Alzheimer Europe. I'm here. I've got two things. First of all, I want to tell you that we have been working on a dementia monitor that benchmarks access to treatment, access to support, access to care in the different EU member states, and we would be happy to share all information we have with you. The other thing is a question. How are you going to work concretely with patient organizations, industry, professionals now? Because we are most willing to support your work and work with you, but concretely, how is it going to happen now? Thank you.
Thank you. Yeah.
Again, me? Yeah. I think we made really great step forward, having the Access Interest Group that was developed in close collaboration with politicians and the stakeholders. I think the Access Group would have the strong support from the stakeholders in the room, and also we will have the high expectations from the Access Group. I believe from now on, the stakeholders have to be proactive and really come with solutions that they think the solutions might work. And I'm sure that the politicians will find a way to bring the solutions to the table of the European institutions and to make them work for European citizens. So one of the ideas actually that we were discussing even this morning within the board of the European Patients Forum is to have kind of a regular meeting between policymakers, between the members of the parliament who are part of the Access Group and the patients' organizations, part of the European Patients Forum, who can actually exchange ideas and think how we can improve that on a regular basis. But not only. I believe solutions should go on your table, and you as politicians, I'm sure you will find a way to bring them further.
This is actually technical sentence. When I hear that stakeholders don't know how to support the platform, this is worrying. So that means we need, or you need, or the platform need to have an email address or something to be published, to communicate to all stakeholders that if you, let's say, mention you like to support the platform, and also us as politicians to know what we should fight for, to have the address. So okay, good. Then we have the commitment from the platform, which should be the representative of all stakeholders, communicating the details. Yes, no, how to contact the platform.
Okay. Any more questions, please?
So I'm Adrian Vanoven, Director General of the EGA, Generic and Biosimilar Medicines Industry. First of all, just to congratulate Stanimir on a fantastic project, and to see where you've taken this project from a couple of years ago to today with the Commissioner and so many important MEPs backing it. I think you've done a fantastic job. Just my question follows up a little bit from the question on the issue of access to medicines. Obviously, I'm from the medicines sector. I think one of the challenges, and maybe I'll be a bit more technical here than the previous speaker, one of the challenges is that over the last 15, let's say, or the last 10 years, Europeans have gotten used to the patent cliff. That is where very important, high-volume, quite expensive medicines have come off patent, and therefore the medicines, let's say with generic medicines entering the market, you've had a lot of savings then and opportunities to increase access, to save money, and to keep the pharma budget sustainable. If you look at the future, where patents are going to go off over the next 5 years, over 50% are on specialty products like biologics, like respiratory products, products which are complex, which are challenging markets to enter. So there will be generic versions of those products, there will be biosimilar versions of those products, so there will be some price erosion, but it won't be the radical, let's say, price erosion that you've seen under the patent cliff period. So how are we going to work together, medicines industry, and I don't want to speak on behalf of the other side of the industry, but I think we do see on a high level eye to eye, but also stakeholders to address this challenge that while there will be competition, it will be very important for sustainability. It won't be the same huge effect of the patent cliff that people have gotten used to.
Was that the question?
Yes. I know it's a little bit technical, but I'm trying to...
I missed the question then.
Over the last 10 years, a certain number of very important medicines have come off patent, and there has been a huge price erosion due to generic competition in those. So a huge savings and opportunity to spend that money in different ways, either for better access or to buy expensive, let's say, innovative medicines. In the future, the molecules coming off patent are much more complex. 50% of them are specialty medicines, which means the price difference between the generic or biosimilar version and the original version will be less. So the amount of savings that there will be to spread around for better access or for new innovative medicines will also be less. So how are we going to deal with the fact that you'll have less room for maneuver in the pharma budget in the future? And can we work together to come up with solutions, basically?
The answer to that question is yes. Is there anyone who wants to...
Just a short answer. It doesn't answer the whole question, but I think it's one of the points might be more adequate use, because we very often do use pharmaceuticals where we don't need them, not the number we need. And I think with a lot of patients, when you talk to them, they do have at home a drawer where they have all the stuff they don't need, and they eat it when they think they should eat it. So I think it's also a question of health literacy, that you know what medicines you need, how long to take them, what's really appropriate, and the same is true for all the antibiotics, because we do have an antibiotics use in Europe that's really exploding. So I think that could be help a little. It's just a percentage, not the full package.
Okay, thank you. More questions? There's one. Please. Please make the question short and understandable.
Okay. I'm from APOSI, John Webber, from the patient part of APOSI, European Platform for Patient Organization, Science and Industry. So we are talking with the stakeholder all together about access. We have a few of these projects coming up from now on to April to the eHealth Week in Riga and in Luxembourg. My question is a very simple one, but a complex one to answer, is the following. We're talking about access in very different levels, but the communication and the literacy and the frailty things that are coming together in all these programs, as you said before, no one knows exactly where and when is it falling in this program or that program. Is that one of the, let's say, things you're taking by the horns, they say on Dutch? Is that the part where we can get in this access committee so that everyone knows where to talk to who in this access of programs?
That was an easy answer to that. It's a yes again.
Okay, good, perfect.
It's part of the, no matter, I'm serious, it's part of the ambition, absolutely. That goes with transparency, cross-communication and so forth. Without that, then it will be just some part of it, and there is only one way to move this in a true direction, and that is to do it in a holistic way where all aspects are involved. So that's why the answer is yes. We have one final question, please.
Yes, hello, my name is Mike Isles. I represent the European Alliance for Access to Safe Medicines. I think there's a good question here, I hope so anyway. It's to do with the Falsified Medicines Directive. As you know, the common logo which will be required by each of the 28 member states to be displayed on an online pharmacy or retail portal And each member state will be obliged to communicate to their citizens the purpose of the common logo and the fact it's secure and it's a proper way to buy your medicines online. For me, this is a unique opportunity to perhaps, and does the panel think it's a unique opportunity to monitor the activity of those member states, how they actually promulgate that, because clearly you have an opportunity to communicate with lots and lots of patients. Thank you.
I don't know the English word for it. In Swedish it's ja. In English it's yes, a little longer. I think it's a great opportunity, and I don't just see now how to do it, but I think we can communicate after this. Okay. Dr. Kovachev, you have some final teaser.
Yes, actually, before the closing remarks, so to close our inauguration meeting today, I would like to announce that among us is also one NGO, which is a very interesting idea to promote networking and best practices in endocrine oncology. And I welcome also the professor from Istanbul University and some of my friends from Bulgaria, Sven, Maria and Alexander, and wish all the best for creating this network. This is, I think, one of the points, best practice exchange and create good guidelines for 21st century adequate treatment and avoid unnecessary treatment. And second one, actually, I had as a closing to show you one short 3 minutes example of one access to dental care in Bulgaria, but unfortunately the technique here in this room is not the best one, so the video is not functioning. I will try to explain in 3 words. This is.
Shall we close our eyes so we can think it?
This is simply. I don't know, other member states I think as well, but in Bulgaria, in small villages, the access to dental care is an issue. And the project is as following: a mobile dental unit moving from one small city to another village and providing the treatment, especially for young people, but also for people who do not have the money to go to the big town or to the other adequate treatment. So I think such a project can be multiplied and could be also supported with some horizontal measure. I will try to support these people, but for the moment I have also doubts if we can do it. Again, thank you very much from my side to be all of us here, and looking forward to continue the cooperation with my colleagues, but also with the platform to find the best solutions for the European patients. Thank you.
Thank you. Thank you. And since time is running out, I would just say thank you very much to all of you who are in the room for taking your time, taking your interest and taking your commitment into this task. And we will contact you again. The information further on this will be on EPF's website, where you can follow it, and will be showing up there very, very shortly. And I also would like you to join me in thanking Dr. Kovachev for opening the door to the Parliament. Showing the confidence in what we wanted to do and to work with us and to open to other MEPs. I'm very happy for that. Thank you very much for that. Thank you. Thank you. So, yeah, it was